the WebEx. So it's first of all, I want to say to you that it's not the first WebEx we do for the COVID-19 situation and in link with first aid. And we will continue to do that in some other language, official language of the Federation. This afternoon it will be in French, and next week it will be in Spanish. So it's very important for us to share and guidance on this terrible situation we have. I just unmute everybody again. So. And during this presentation, don't hesitate to write questions in the chat. We will answer at the end jointly, and really put your question on the chat. On the chat also, again, I ask you to say where you come from, who you are, and it is a pleasure to know. I see that many people are coming from Africa, from Asia Pacific, from Europe. So it's incredible. So it's really important, and at the end also, if you want to express a question or remarks, raise your hand with the Zoom button, and it will be possible, of course, to have some question on live. So that's good, and now we begin. We go on the subject, and I let Diane, who is working with me in the Global First Aid Reference Center, to begin with the first slide.
Good morning, everybody. Happy to see that we are so numerous, and it's a good thing to start all this webinar series, because it's a way to network and to have discussion all together. So first, I don't know what is happening yet.
I have a technical problem. I just have to change.
So first, we will start with the missions of the Global First Aid Reference Center, because some of you do not know what are the missions. So first, there is no order. We aim to harmonize first aid and facilitate knowledge sharing, to promote an evidence-based approach and research in order to provide quality first aid education, to advocate for first aid, to support through evaluation and technical advice resilience programs adapted to community needs, to coordinate and lead the global first aid network, and to develop resources and make economies of scales. Besides these missions, we are developing expertise in different topics, such as first aid and aging population, first aid and children, first aid and road safety. There is a series of thematic. And also we are working on international curriculum on trainers of trainers, and curriculum on trainers. So now let's go to the first aid by the general public. In fact, today we won't make any slide on how to treat COVID. The idea is to provide some tips for first aid education and for first aid provision. So let's start with the general public. A question you may have is, can I still provide first aid? Of course, there is a need of continuity in the provision and promotion of first aid, knowing that with COVID, emergency services may be collapsing or overbooked. So it's important to keep the knowledge of first aid and to continue. What is important, of course, is to wash hands before and after first aid provisions, to respect the social distancing, to have protective personal equipment, and also prevention is important, and we need to make emphasis on prevention. Next one, please. So sometimes we may not have clean water to wash hands. There are two solutions, hydroalcoholic solution or ash, which can be used. What is important to say is that this is only for washing hands and cannot be used for burns, for example, because we know that cooling is important for burns, but ash and hydroalcoholic solution cannot be used. So this is only to have clean hands that you can use this three solution: water, hydroalcoholic solution, and ash. Next one. Pascal.
Just I forget to active my microphone. So now it's important to go in detail in the normal first, and how we have to change our habits during COVID situation, but of course during all the pandemic or epidemic situation, because in fact COVID it helped us to understand that probably by the past we don't took into account these important change we have to do when a pandemic or an epidemic situation arrive. First of all, concerning the management of an unconscious casualty, is very important to avoid contacts with the air or gave by the victim, by the casualty. And of course, we change our habits, and we can observe only the chest and the abdominal regular movement. You know, you have to see if the casualty has a normal breathing. But in this case, we don't go, and we don't have to be near the mouth of the casualty, because it's of course dangerous in terms of infection, transmission of the infection. So be careful for that. Second, concerning the what we have to do, we have to define different situation. Do we where if we are of course at home in our familiar environment, or a foreigner environment. When I say foreigner, it could be of course outside, or perhaps also in the working area. First of all, we have to be very careful of the aerosolization of the virus, because that's the problem of the techniques, especially because when we are pushing the chest of the victim, of course, air is going outside, and we have aerosolization. And as you know, the COVID and other viruses are in the air, who is go out of the casualty. So very, very careful for that. Second, call the emergency medical system, or of course, do what you have to do. We will see that we have to be adapted to our environment. But if you have an emergency medical system, of course, call it very, very clearly, very, very urgently. In the street or at the office, in case of cardiac arrest, the victim is unconscious and not breathing normally. In this case, we are in the cardiac arrest, and we have to do hands only, because hands only is recommended, of course, to avoid infection between the casualty and the first aider. If you are at home, or if it is an infant, we have to consider mouth-to-mouth resuscitation. Why? Because at home, we are all in the same environment, and probably the level of infection is the same for all the members of the family. And of course, we can do probably the classical CPR, if we are, of course, confident on that. Even we do hands only, but for familiar person, or for infants, because infant, the cardiac arrest, as you know, probably came from a ventilation problem and not a cardiac problem directly. We have to consider the mouth-to-mouth resuscitation. Considering the advanced first aid. Now
Pascal, just 1 second. Some people are asking how they can see the PPT, so I don't know if there is something to make.
Normally, because if you are in a computer or even you are in your iPhone or your smartphone, you can see, because everybody at this time is I share my screen with everybody, and it's not from our side. Normally, Zoom, it's possible for you to see the presentation. In case you have not, it will be a pity, but of course we can continue. But don't worry, because we will this presentation it will be possible to download it in our website, and also in other possibilities. So normally it's your device who are able to present you the presentation. I continue with the advanced first aid. And advanced first aid, of course, it's very important. We are talking about our volunteers. We are talking about your advanced first aid. We are talking about our community health providers, and it's very important to protect them, because if we want to continue our action at the Red Cross Recreation Movement, of course, it's very important to have a safe environment for our volunteer. For that, what we use, of course, personal protective equipment. This protective personal equipment depends on the level of the possibility of your country, of your national society, of your local possibilities. But if we want to be perfect, it's very important to wear first gloves and mask. Mask is the most important, because as you see, the aerosolization of the virus, it's so important that the mask is the most important. Of course, we can use surgical one or FFP2. It's a more advanced and protective mask. We can imagine to have also a mask with tissue, but of course, for advanced first aid, it's not enough. And if possible, and if we have the money to buy it, of course, it's very important to use this surgical mask or the FFP2. Third, we have to use, if it's possible, protective glasses. Of course, if you are wearing glasses is one thing, and it's not so bad, but it's not enough, and protective glasses are better. After we have to use disposable protective cap, if available, of course, and last and not least, disposable gowns. That's the material, and of course, perhaps for you in your environment, some will be available or some or other not. But it's important to give you what could be the perfect equipment. That's one. What are the rules for first aid, for advanced first aider? Of course, the PPE, the personal protective equipment first, but also to use bag valve mask, insufflator, to give ventilation, because it's of course important. Concerning fever, because in this pandemic situation, we have to see if people have fever. It is of course better to use eardrum or infrared thermometer. And that these thermometer remain valid for all first aid activities, and avoid again transmission of the infection. Concerning the oxygen administration, it's very important, of course, to continue as we learned by the past how to use oxygen. But it's important to place a surgical mask, other the high concentration mask if you have, or that. So with that, the expiratory valves are covered. Again, it's to avoid the aerosolization of the virus and it's very important. After we have to see how we have to plan the rescue operation in time of COVID. Of course, it could be done by vehicles if you have in your country, in your national societies, but it could be also for place where you are giving first aid. You have to make sure that all surfaces are dry and let air into the vehicle or the health units. That's very important. Ensure also adequate stocks of equipment are available for all your volunteers, and well positioning for easy use, and that's very important. Put a disposable sheet on the stretcher if you put the casualty on the stretcher. Prepare a large medical bag in the vehicle or in the health unit, and close the vehicle and the health unit after. Of course, and don't remind that it's very important to and always disinfect the whole vehicle or the health unit after each mission, because that's avoid again transmission of the virus. Really, it's important, and it's an essential time after the Red Cross Red Crescent mission to disinfect the whole material and the whole vehicles or first aid places. And last and not least, what is the washing guidance for equipment and material for rescue? It's very clear. Again, we have to avoid to disperse the virus, and for that, don't check the dirty laundry first, because it minimizes the possibility of dispersing the virus in the air. If the clothing can't be immediately laundered, it could be the reality when you are far away and or perhaps in a situation where you are not able to immediately launder your clothes. Store it in a sealed disposable bag, and after you will launder it after. All the items must wash using the warmest appropriate water. It's the best is the 60 degrees Celsius during 30 minutes to have the best results in terms of washing. That's the what we have to say about the advanced first aid. And now we go ahead with a very, very important part of our action during this sort of situation of pandemic, which is very stressful for the casualties, but also for our volunteers. And we are going to speak about psychological first aid.
So COVID situation may form of stress, and it's important to protect caregivers and first aiders. So what is important is to provide specific support information, which is also accessible remotely online, to open to all staff and volunteers. It's important that they talk to their loved ones and or their colleagues at the Red Cross, that they share their feelings if they don't feel well. And protect caregivers on the front line by encouraging them to take breaks, by organizing team rotation, and keeping in mind the protective factors. So we should be careful about the fact that sometimes the impact can appear with more delays than during the crisis, but it can appear after the crisis. So be careful about that. In terms of first aid trainings, here are some advice from us. So can I continue to organize classical first aid training or awareness sessions? Of course, it's not recommended to gather many people in a place. So follow, of course, the local contents and what are the rules in your country. Try to promote blended learning. And when you have to make the practice, think about the reduction in the number of trainees per classroom. If it's possible, it's very good with the nice weather we have now to train outdoor, because the virus is less spread outdoor than in closed rooms. Think about the disinfection of the material, plus, maybe more than before. Think about the social distancing. And in terms of pedagogy, it may be different. You will receive a guide which is about 20 pages guidance, where you can see how to adapt your pedagogy during this period. So maybe all this will require to plan and prepare before you restart your first aid course, for those who stop the first aid course. Next one. So important to consider: promote or set up distance, enforce the sanitary measures and the rules of physical distance during the face-to-face training, and increase the protection of the trainers, because of course we should take care of our trainers.
So with that, we have to underline what are the key points. I took I saw some question, very interesting question, and we come back on this question, of course. Just to summarize the key points of this presentation. First of all, we give guidance. It's not standardization. It's just harmonization, because we are living in of course, so many different environments. We have to take into account our regulation, the law, the rules given by the government, and of course, our habits and our possibility of care. Because of course, some of us have the chance to have material and to have perhaps more money than others. And of course, we have to take this into account for what we have to do. But first of all, we have to continue our Red Cross and Red Crescent action as we have to do according with our principles. But please follow first your national regulation to not be in opposition in the environment where you are living. First, second point is that first aid provision and training must continue even with the COVID-19. And of course, we have to adapt our position, because we don't know if the COVID-19 will disappear, but probably in the future we will have other infection, other pandemic or epidemic situation. Our African friends had so many infection and pandemic situation, and of course Ebola is a terrible one. We have to continue to the provision of first aid, but in this case we have to work all together to think about how to adapt our first aid according with this very dangerous situation sometimes. Of course, it's also for people of the street, for the citizen, and for our volunteers, it's very important to reinforce the idea of hygiene. Hygiene is sometimes forbidden because in the normal life, so we have many things to do, but it's the most important to take into account. Of course, cleaning hands before and after providing first aid. And that's very, very important. And last and not least, as I talk about, is the protective personal equipment. For the future, it will be necessary after a crisis, because some of us are after the crisis, some other are during the crisis again. But it's very clear that we have to think about how to increase the level of protection of our volunteers, how to perhaps have gloves, masks, or other devices, and many good ideas can of course be used to protect our volunteers, because it's our role, it's your role. You are with us now, more than 100 people, and it's fantastic. It's very clear that we have to disseminate this idea of hygiene and during pandemic situation and protection of our volunteer during these pandemic or epidemic situation.
So in terms of tools, so we have developed some tools at the Global First Aid Reference Center, even some tools for the children. In fact, you can have all the tools related to the COVID on the webpage of the Global Disaster Preparedness Center, because all the reference centers had some tools, prepared some tools, and the idea of the federation was to put on one place the tools. So we will give you the address, but otherwise this is the website of the Global Disaster Preparedness Center, sorry. Next one. You can find tools also on the Go platform, because I saw that there is a question of blended learning. We have developed some first aid courses online for adults, for aging population. So you can find also the information on the Go platform and the health help desk. We will send you all this. And do not forget, if for one reason or another you don't succeed to get there, please write us to the address first.ed@ie4c.org, and we will send you the information. So this is the end of the presentation. We had some question in the chat. So Pascal, we will start with one question on CPR. Is it enough to make only a chest compression? Is it not a problem to stop with the mouth to mouth?
Effectively, it's a very important question, but it's you can read that on the guidelines 2015, and you will have this part of the evidence concerning hands only on the 2020 guidelines. Will be published at the end of this year by the Global First Aid Reference Center in the Federation. And what can we say about hands only? Hands only is very important to do because, of course, people could be perhaps without a training, or perhaps after a training, they can be not confident with the mouth to mouth. The mouth to mouth is the most difficult thing of the CPR, and we have a very important evidence that's hands only. It gave more efficient CPR than no CPR. For course, survival rate with hands only is higher a lot compared to nothing. Of course, we keep the CPR with the cardiothoracic pressure and mouth to mouth as the gold standard. But if your participants is not aware or is not confident with the mouth to mouth, we can say them, do just the thoracic pressure. It's very good also. So I saw that this question during the chat. In the normal situation, we have not the same the same advice. Of course, we give the training with the gold standard, but at the end we can say, okay, if it's difficult, if it is a foreigner or you are not confident, so do the thoracic pressure. Of course, call the emergency service, call the help to have an help, but do the hands only. That's the difficult explanation you can give to the participants, but it's the reality, and it's very clear. I see that a remark of cooperation only life support by Indian Society of Anesthesiologists is effective and evidence-based. For sure, it's evidence is an evidence-based, but we will keep probably for the 2020 guidelines and we are working with the International Liaison Committee on Resuscitation. We will keep the gold standard for everybody, but as you said, we know that the hands only is also effective. I saw also another question, and Diane, after you can remind me if you see other question. I saw a question about psychological first aid, and you underline the importance of PFA, and you said that sometimes it's not enough done. In fact, PFA must be in every training. It's not a specialization of people. It's very at this time all our volunteers are to take into account the psychological aspect of each situation. We are not stopping an hemorrhage. We are taking in charge a person who is bleeding. That's the difference. Stopping an hemorrhage is just a technical aspect. Taking into account a person who is bleeding is, of course, stopping the hemorrhage, but it's also taking into account the psychosocial aspect. And that's very important. And we have to include psychosocial aspect in all the first aid situation, because of course we can say, oh, you have to reassure the casualty. But of course it's not enough to say it. It's necessary to say that you have to take the hand of the victim. You have to reassure her and to speak with her. And of course, again, if we are in the pandemic situation, we have the social distancing, but the psychosocial support is not just the contact. Of course, it's also the voice. It's also the how we can exchange with the victim. Very important remarks. Thank you very much.
Another question, Pascal, related to water safety. Do we have some advice to give to the first aid provider on beaches or in swimming pools?
Again, a very good question, because effectively, when we are talking about mouth-to-mouth ventilation, we have two situations where it is important. Is the infant situation, and we talk about the infant situation during the presentation, but also droning. It's the official advice. It's of course to do ventilation. If it's an advanced first aid, of course we can use of course the techniques to avoid aerosolization. Of course, if it is first aid provider, again they have to take into consideration this possibility to give mouth-to-mouth ventilation, because we know during droning that the ventilation is the most important thing, and it results on the cardiac arrest because of lack of oxygen. So it's another situation where we have to consider the possibility to give mouth-to-mouth resuscitation.
Thank you, Pascal. Someone wants to know more about the blended learning. So as I said, there are some first aid courses online made by us with the secretariat at the Federation. After I will let Pascal explaining more about these two aspects of blended learning at home and learning with the Red Cross trainers.
Effectively, it's important to take into account during pandemic situation the continuity of our action in training, and many national societies has the chance to have some videos or really e-learning, and in this case we have to use it. Of course, all the first aid training can't be by distance. At one time it will be necessary to be together to, of course, explain in detail a technical gesture, and of course to have this contact, the human contact, who is very important. But during this terrible situation we have, of course, e-learning and of course MOOC or other massive online training or other things who can be the link between the Red Cross and the Red Crescent with the population. We have to continue, and we have to define each other which part of our training could be done by distance. In this case, you will have a part done by distance. Of course, you can give knowledge to participants before they have the practice, and with that you win time, and it's good, and you probably you increase the level of retention. So concerning that, I think the pandemic situation is one situation where we can develop this possibility, if we have this possibility in our national society, because it's not possible for everybody. Diane, I saw a raised hand, and perhaps we can give the floor to Abhishek Rima.
Thank you, Pascal. I just want to confirm, if you can hear me.
Absolutely. Yeah. Perfect.
Yeah. Thank you for this wonderful presentation. I would just like to ask the Global First Aid Reference Center, are you thinking on developing some guidance note or some document for the national society who wish to conduct first aid training in a COVID safe manner?
Yes. So this afternoon, those who are in our contact files, you will receive this PowerPoint. You will receive a PowerPoint that you can use for your trainers to present to your trainers what are the measures to take in terms of protection, how to adapt the pedagogy. And you will receive a guide which has about 20 pages about advice in terms of pedagogy, but also in terms of techniques we spoke about, like CPR, like hemorrhage. For those who are not in our contact list and can't receive this afternoon the message because you are not in our contact list, please write us to first.ed@i4c.org in order we send you all the presentation and the guide. Moreover, as I said, in the Global Disaster Preparedness Center, you have all the tools made by different reference centers. So if you want to know more about psycho or other topics, you can find on the website Prepare Center. So prepare like prepare center, CENTER.org. And you just type else help desk, and there you can find many files from all the different reference center of the federation. For example, I see advice on home care and older people. I see advice on what are personal protective equipment, advice on water, sanitation, and hygiene. So you can find many topics. Of course, first aid is included in this page.
Thank you, Dan.
Thank you very much.
Pascal, I saw a question on just 1 second.
I saw the PFA link for the psychosocial first aid link. Very important. If you can copy and paste the link. Thank you for your participation in the chat. You can see you can go directly to the recommendation of our colleague of Copenhagen, where we have a very efficient reference center on psychological first aid, and you have this link on the chat.
I saw a question on severe bleeding.
Yeah, concerning the bleeding, effectively, no problem concerning the bleeding. In fact, remember that the COVID situation is in fact a virus in the air, and it's the aerosolization which is the most important. We have not to change our habits concerning hemorrhage. Of course, we have to protect ourselves with the other infection, and if possible, we have to use gloves, or for the lay people, tissue, or better, a plastic bag, for example, or ask to the casualty to do the first gesture, stop the hemorrhage, to avoid direct contacts with the blood. But concerning the COVID situation, we have no more advice or no more guidance to give concerning this situation. I saw a pedagogical question. I don't know if you see, Diane, concerning the ratio of the participants. That depends of your environment, really. Classically, we said maximum one educator, one instructor for 10, but depends of the what is your target group, what is your material. Do you have many mannequins? The environment is possible to have 10 participants for one instructor. Do you have another volunteers with the instructor who can help him to take in charge the participants? So it's very difficult to give a strict recommendation. We have some good practice points concerning that. In normal situation, we said yes, 1 for 10, it's not bad, and it will be probably an advice for the international first aid attestation we are developing at the level of the International Federation. That's very interesting, but it will be effectively a guidance. And during situation as the COVID 1 and 2, respect the social distancing. Of course, some recommendation coming from outside the Red Cross also said that 1 for 6 is the best one. But really, take that into account with respect of your habits, with the respect of the participants and the target group, because it's not a real strict thing we have to follow absolutely in all country, in all region.
I don't see any other question in the chat, so I don't know if someone wants to raise hand or.
I don't see any people who are raising hand.
Can social distancing can be maintained during practice, Pascal?
That's different. If you are training lay people, or if you are training advanced, if you are training your volunteers. Concerning the lay people, we have to be in accordance with the local recommendation in your country, and of course, as you saw, normally we propose 1.5 meters between each participants, and of course you will see in our guidance for training and to restart the training during this period. We propose to teach the gesture in themselves. So we ask to the participants, for example, to stop the hemorrhage on their own arm or in their own legs. but it's very clear that it's a recommendation we gave for that. I just see we have some noise. I mute some people. Great. Right. So it's very important. It's very important just to avoid the contact between one participant to another. If we go ahead in some guidance, you will be able to read in our guide, for example, for this obstruction, for foreign body obstruction, we said that we have the participants have to show where is the part where they have to do the Heimlich maneuver, and of course just to present the backbone and the Heimlich maneuver, perhaps with a poster, and to avoid the contact between one participant to another. That's one. For the lay public, we have to take into account, and you will be able to read that in our guidance, in our guide. Concerning the volunteers, it's quite different. If you are able to give them some gloves, at least, and one mask, because in this case you can continue to use a classical pedagogy, avoiding too much contact, of course, but there will be more protected by the PPE. So that's different from the lay public training and the volunteers training, as you see.
Maybe Pascal, someone needs more explanation on the protection during when there is severe bleeding.
And severe bleeding, it's very clear. I mean, you can also read that on the 2016 guidelines, and it will not change in the 2020 guidelines. You have to protect yourself from the contact of the blood of the casualty, and for that, if we are training lay people, we are using a tissue, or we are using a plastic bag, for example, and that's very important for our volunteers. Of course, they are using also gloves, and after we are able to use other things, as of course compression bandage, but it doesn't change nothing during the COVID situation.
Do we have other question? Is there any planned support from JFARC to the national societies for development of online first aid courses? Or is it possible to have support for such of this?
You can answer, or
Yeah. So as I said, we have made some course online on adults, children, babies, and aging population. And we will make a special module on COVID, so you can access these courses, in fact. After, we have also a list of national societies who have already blended learning, a very efficient blended learning system, so we can only send to you the list of national societies if you want also experience from others.
A question concerning the training, do we have to prepare the place of the training? Of course, when you will give training during this the COVID situation, it's very important to prepare your place of training, and to avoid, of course, the contact with participants. Of course, you have to put some advice poster we have advising which exists in many countries. So in our guide, again, we will draw that, and you will be able to write that. Again, it will be guidance. It will be to take into account with your reality, with your environment, but we give you some advices concerning that, You, as Diane said, you will receive that. You can download it, these guidance, and for you it will be very useful. And after you can, of course, take into account your experience and follow and perhaps complete this guide, and don't hesitate to give us your feedback on this guide. We will be more than happy to have your proposition, your remarks, and to increase the level of this guidance, taking into account your experience.
Another question is on the valve mask. Back valve mask. If you are using a back valve mask, for giving rescue breath, is it advisable to use 2 rescuers in this case?
In this case, absolutely, because it will be better to have two rescuers. One is blocking the mask, and the other is using the BVM, the valve mask. That's better. It's also important to you can use, and again, depends of the country and the possibility of material you have, because we have some special valves who are able to filter the aerosolization and avoid the aerosolization with this ventilation. So depend again of the level of equipment you are able to buy and to have in your national societies, but it's better. In case of oxygen, as I said, it's important if you are using high mask concentration, it's a high concentration mask. It's important to cover this high concentration mask with a shared surgical mask, for example, again, to avoid the aerosolization.
Then before arranging any training session, it might be wise to check the COVID-19 for the trainees and the trainers. How can we make it easier? How do we ask that to the trainers and trainees to make sure they don't have fever, they don't come with fever in the classroom?
Yes, you will find that in our guide again. We said that it's important before, and I saw some national societies, and of course, if this guidance exists, it's because we take into account some very interesting publication of national societies. You will find that in our guidance, and we said that you have to, before the training, to ask the participants if they are on good health, and ask them effectively if they have no cough, no fever, and of course, in this case, if one is said yes, please advise these participants to come back later and to not follow the course you want to give to the population or to the volunteers.
Maybe it's our last question. If you don't have any PPE and you find someone bleeding, what to do during this period of COVID?
No change. Again, it's the third time we are talking about hemorrhage. Remember, at this time we have no transmission of COVID by the blood, and it's very clear that the problem is for all the other infection that we have to take into account the security of the provider. Even it is the lay public, or even it is the volunteer, and of course you can use a tissue, just a tissue, to avoid the direct contact of your hand with the blood of the casualty, or if possible, if psychologically the victim is able to do that by herself. In this case, you ask to the casualty to press on their own hemorrhage, and they do that, and you take some time to find a compression bandage, probably not a manufactured one, but a simple one, to stop the hemorrhage. But no difference between the normal situation and the COVID situation to stop hemorrhage. Take your own guidelines. It's the same.
Francis Atto raised his hand.
Yes, please take the floor. You can unmute by yourself. I don't see raise hand.
And otherwise, Prachi Batnagar, sorry for the pronunciation.
Yeah, can you hear me? Can you hear me?
Yes, Francis. Yes, Francis, with pleasure.
Yeah, thank you very much. I'm a volunteer from Nigeria. It's a very informative and educative session. Actually, the last question you just answered concerning stopping bleeding in this COVID-19, you actually answered it the right way I wanted to. I really want to hear what to do, which I think you said we must take precaution first. So thank you very much. Thank you very much. It's a very educative session.
Well, thank you to you to be here.
And also Prachi Batnagar, if you want to talk. Maybe we lost.
Yes, we lost it because I don't see him or in the list with the raise hand at this time.
Another question, does the rescuer wear mask during chest compressions?
Yes. In fact, it's better if you have mask. It's of course better to keep the mask with you, your mask, your personal mask, because as I said, during the thoracic pressure, we have a aeroization, and of course it's better to protect yourself and to ask to of course to teach that to your participants. So thank you very much. It's 11 o'clock, and it's very interesting. Oh, I want to give to Owal the floor, and just I will close the WebEx after. Owal, take the floor, please.
All right. Thank you very much, Pascal and Diane, for this wonderful presentation and clarification. Maybe just, I just want to chip in one thing on the issue of the blended learning, because in this situation of COVID-19, I had an experience of using it in one of our training. And what I did, we don't have application customized to Nigeria, but we use the IFRC Phase 8 Africa application, which I share the links to all the participants. I'm going through all the topics in the links, and it gives us easier shorter time to conduct a Phase 8 training within this short period, because we are able to go through the question and do some quiz for themselves and apprehend it, so it becomes very easier for us. So in case we don't have application customized to countries, I think that Red Cross Phase 8 apps for Africa.
Hello?
Yeah, we lost Owal. The last word of Owal was cut. I don't know why. But it was a very interesting remarks concerning the distance learning and that's very important, and the blended learning. Thank you very much, Owal, because it was cut. I don't know why. So I have to effectively to close this WebEx. I was very, very, very impressed with the number of participants, more than 100, and it's terrible because it was the maximum we can receive, and probably people who want to be in the WebEx was not able to go in because we were more than 100. So thank you very much. If somebody said you that I was not able to attend the WebEx, say them, give them all the links we give you with that. So thank you again for your participation. If you are speaking French or if you are speaking Spanish and you want to talk again, it will be possible this afternoon in French, next week in Spanish. And be careful, safe for you, for your family and for your volunteers. And thank you very much to be with the Federation and the Red Cross, the Red Crescent, and we hope to do in the future other WebEx, because it's our role to be in contact, close contact with you. Thank you very much to all of you.
Thank you and take care. Bye.
Bye. Take care.
Bye.
Bye, Colin.
Bye-bye.
Thank you all.
Bye, everyone.
Bye.
Thanks, guys, for the splendid presentation. Thank you very much.
Splendid. Wow.
Bye, everyone. Thank you for the presentation.